Wendy, that's the ER where Brian Sinclair died 6 years ago. A lot has changed since then, but this report is recommending much more.
That's Brian Sinclair in the wheelchair. Hospital video shows him coming into the ER seeking care for a bladder infection. He's never registered. In over 34 hours, he's never checked on by medical staff, until finally he's discovered dead.
He shouldn't have died that way in the first place.
His cousin says the inquest doesn't answer all of his questions.
The burning question is, why did he wait there 34 hours? To me, that's the truth. That's the truth that we seek.
Sinclair was a 45-year-old First Nations man, a double amputee with chronic health problems, and a frequent user of Winnipeg's largest ER. The inquest found poor communication, overcrowding, and understaffing all contributed to what it called compassion fatigue and lack of timely care.
I want to apologize to Mr. Sinclair's family.
Manitoba's health minister says improvements have been made and will continue. Officials accepting the majority of 63 recommendations, including electronic patient charting, improvements to ER design, rotation of ER staff, and check-ins with patients at least every 4 hours.
We need to ensure that all who enter our emergency department or health facilities receive the care that they need, regardless of their race, economic status, ethnicity, or sexual orientation.
But the inquest never did look into racism or stereotyping. That's where Sinclair's family lawyer says this falls short.
Based on those stereotypes, they assumed he was there because he was drunk or homeless or otherwise not in need of medical care.
Robert Sinclair would like a deeper investigation.
Once we get that, then we can actually say Brian didn't die in vain.
As for those recommendations, authorities here say they had already been working on many of them and that they're making progress. Still, there's a lot of work to be done. Earlier this year, a national survey of ER wait times ranked 4 Winnipeg ERs among Canada's 5 worst. Wendy?
Thanks, Cameron. Cameron McIntosh. You might be wondering about the hospital staff. The inquest was not a trial, of course, and no one has been fired. But the head of the Winnipeg Health Authority says all are accountable. She also calls it a career turning point, noting that some of the nurses subsequently quit the profession.